Good morning, everyone. Today we'll begin an important topic in pharmaceutics. That is parenterals. Parenterals are sterile dosage forms that are administered by injection through the skin or mucous membrane. Directly into the body. Unlike the oral dosage forms, parenterals bypass the digestive system and provide a faster and more controlled drug action. These parenterals are used in emergency treatments and surgeries and for patients who cannot take medications orally. In this class, we learn about introduction of the parenterals and types of parenterals. According to the parenterals, we classified routes of administration of the parenterals and types of parenterals. And we can see in the advantages and disadvantages of the parenterals and pre-formulation factors and coming to various forms, nature of the drug and the required effect. They can be broadly classified. And next, formulation of the parenteral products and quality control test for the parenteral products. We coming to the pharmaceutical parenterals. These are sterile products. Sterile means it free from the viable microorganisms. That are administered directly into the body tissues rather than the oral route. This parenteral means this word coming from the Greek word. We can divide it to the two parts. Para means it means avoid the intestine. Enteron means enter into the IV system, intravenous system, or any other directly into the body system. Parenteral products are unique among dosage forms because they are injected through the skin or mucous membrane into the internal body compartments. Coming to the definition of the parenteral preparations, these are sterile and pyrogen free liquids. Pyrogen free liquids means it includes solutions, suspensions, or emulsions, or containing one or more active ingredients packed in the single or multi-dose containers. These are intended for administration by injection, infusion, or implementation into the body. These parenterals directly into the veins, muscles, or under the skin or more specialized tissues such as spinal cord, etc. Coming up to they can broadly classified into the types of parenterals. Types of parenterals, we had that small volume parenterals and large volume parenterals, powders for injection and concentration solution for injection, implants and injectable suspensions, and oily suspensions and sterile solids. Coming to the small volume parenterals, these are sterile injectable products containing the solutions or suspensions. It can be volume less than 100 ml. This is used for the injections and IVs, intramuscular and subcutaneous. And these are water for injections and or other non-aqueous base or mixture of the both. So small volume parenterals examples we had the adrenal injection and insulin injections. Coming to the next, large volume parenterals, these are composed of the sterilized aqueous solution of active ingredient with water and continuous phase. These volume having the more than 100 ml and commonly 250 ml and 500 ml and 1000 ml. Used for these one fluid replacement, and nutrition or electrolyte balance. These are the examples of the large volume parenterals, dextrose injection, and Ringer's lactase. And coming to the powder for injection, drugs in dry powder form. Then it need to be reconstituted with the solvent before injection. Used when the drug is unstable in liquid form. That's why actually we are making the powders for injection. Example, ceftriaxone dry powder for the injection. Next, concentrated solution for injections. These are solutions diluted with the water for injection before administration through the injections. Next, implants. So these are sterile preparations insert into the tissues and release the active ingredient for the long periods. So these are packed in the sterile containers individually. And next one, injectable suspensions. These are actually mainly, it involves the solid drug particles suspended in a liquid medium. So this can provide the sustained or prolonged action. So examples we are taken into the methylprednisolone estate injections we are taken. So and next injectable emulsions. These are liquid preparations in which the drug substances are dissolved or dispersed in a suitable emulsion medium. So these are lipid soluble therapeutic agents or administered the intravenously. And next oily injections. These are used for the prepare parenteral controlled release dosage forms. The drug releasing oily injection is controlled by the drug partitioning into the aqueous medium from the oil medium. So examples given mostly by the these oily injections for the intramuscular route we are given. And this is used for the slow release of the drug over time. So example, testosterone injections we can use that. And next, sterile solids. So these were dry solids dissolved in solving and then administered into the body. And next, coming to the next slide, routes of administration of the parenterals. So main routes of administration of parenteral means we are given into the parenterals patient for the uh, so next, intravenous directly into the patient veins. That's called intravenous parenteral administration. So next, intramuscular. These are injected deeply into the muscle tissue. And next one, subcutaneous. These are injected under the skin or fatty layer, but not for the muscle. And next, coming to the intradermal, injected into the top few layers of the skin. And next one, intra-arterial. This one injected into the arteries. So here we can see the picture intra-arteries. Okay. And next, intracardia. We are given into the heart muscle or ventricle in times of emergency. And next, intrathecal. This is given into the subarachnoid space that is surrounded by the spinal cord. So intraosseous. This is given directly into the bone marrow. And next, intraperitoneal, directly into the peritoneal activity. So means here stomach is there, and here the peritoneal cavity is there. We can directly into the peritoneal cavity. And next, intracisternal, injected between the first and second cervical nerve. And next, coming to the peridural, so injected in the into the between the dura mater and inner aspect of vertebra. And next, epidural, injected near the spinal cord, such as this one can affect the local nerves. Okay, so and next, intra-articular, directly into the articulating ends of the bones in a joint. So we can say clearly seen in this picture, intra-articular. Next one is cerebral. So these are injected into the cerebrum. This one actually we can use for the open brain surgeries, and intra-articular means who are suffered with the knee joint pains and knee joint place replacements. This can be very helpful to the parenterals to the patients. And next, advantages of the parentals and useful for the patients who cannot drugs orally, and especially for the patients unconscious and uncooperative. And next, parentals are takes into the rapid onset of action and no chances of the missing dose. So the drug is directly released into the bloodstream by injection. So the minimum drug is needed to the produce the effect and there is no wastage. So that is very helpful to the patients for the parenterals. So essential for drugs with the poor bioavailability and degrade rapidly within the GIT, and useful for the emergency actions and providing the sustained drug delivery. And it will be very helpful to the avoid a first pass metabolism. And next one is complete bioavailability and low toxicity as compared to the solid dosage forms. When we are patient's food cannot be taken by the mouth and total nutritional requirements can be supplied by the parenteral to route. So that's we called actually another name is also known as parenteral nutrition products. Okay, and next disadvantages of the parenterals manufacturing process requires aseptic techniques and pain on injections and need of medical help for the administration and trained person is required and difficult to reverse and administer drugs effect and very sensitive or some patients are suffered with sensitivity and allergic reaction. They are not supposed for the these parentals and next requires for the specialized equipments devices and techniques prepare for the administered drugs. Means examples we are taken into the patients for the injections, I mean IV sites and intramuscular and cannula sites. These are helpful for, I mean, used for the patients. And these are more expensive and costly to produce. And chances of the improper dosing and danger of blood clot formation. And coming to the pre-formulation factors and essential requirements. So, pharmaceutical factors affecting the parenteral administration, solubility of drug, and the volume of injection. It mainly depends on the nature of vehicle and types of the dosage form and formulation ingredients and pH and osmolarity of injectable solutions, color of the formulation. And first one, we are coming to the solubility of drug and volume of injection. So before a drug is administered through the intravenous route, the drug should be completely solubilized in the vehicle chosen. So volume of injection can be determined by the extent of drug solubility in its intended vehicle and dose required for the desired therapeutic effect. So it will be very helpful to the mainly depends on the therapeutic effect. And the nature of the vehicle means drugs in aqueous vehicle administered by the any parenteral route. And non-aqueous vehicle means administered by the intramuscular route. In case of the mixed solvent system, intravenous route of administration is preferred. And precipitation of drug at the infusion site should be prevented. And types of dosage form and parenteral dosage forms mainly include solutions, suspensions, emulsions, and sterile solids for the reconstitutions. And suspensions are administered through intramuscular or subcutaneous routes. Drugs administered through the intravenous route should be clear and not contain any particles. That's why actually we called uh, sterile parenteral dosage forms. And before administering sterile solids via intravenous route, they are dissolved in reconstituting diluents. And coming to the formulation of the ingredients, formulations are made up of the significant therapeutic ingredients and excipients. Antimicrobials are added to the preserve sterility. These all surfactants are added to the maintain solubility of the drug in the vehicle. So far we are achieving the desired duration of action. Additives like high molecular weight and polymers or oily solvents are added. So these formulations containing such as macromolecules and administered through the subcutaneous or intramuscular route to allow the delayed release of the active ingredients. So, next class will continue the session